Good day, everyone. I am Julian Patricia B. Sarmiento from Mabini College's BSN 1B, and today I'm going to perform a return demonstration on the assessment of the eyes, ears, nose, and throat. First thing we have to do is gather all the equipment that we'll be using. Next is to perform hand hygiene, which are the hand washing and sanitizing, as well as identify ourselves and our patient, provide privacy, and explain the procedure. We also have to conduct an interview to know the patient past health history and their chief of complaint. We may now begin the procedure. Ma'am, do you wear contact lens or eyeglasses? Do you use any contact medication? Do you have eye infection, surgery, or injury? When was your last ophthalmologist visit? So, the first thing we have to do is to inspect the eyebrows and eyelashes for hair distribution, alignment, skin quality, and movement. As I inspect, the hair distribution is normal and even. The movement is normal and the direction of curl is normal. Inspect the cornea by using a pen light for clarity and texture. Next is we perform the corneal sensitivity test to determine the function of the fifth cranial nerve. Inspect the anterior chamber for transparency and depth. Use the same oblique lighting used when testing the cornea. Inspect the pupils, color, shape, and symmetry of size. Assess each pupil's direct and consensual reaction to light. Assess each pupil's reaction to accommodation. Next is the assessment of the visual fields, so we assess peripheral visual fields.
Stop na, stop.
Palagay po na ako. Tapan mo din ito.
Wala ka ito, wala ba ba?
Next is the assessment of the extraocular muscle test. We assess 6 ocular movements to determine eye alignment and coordination. As I assess, there are no difficulty on moving the eyes of the patient. As I assessed, there are no difficulty on moving the eyes of the patient. Lastly is the assessment of visual acuity. We assess near vision and distance vision. So we're going to perform functional vision test if she client is unable to see the top line 20/200 of Snellen chart. After the assessment of the eyes, we may now proceed to the assessment of the ears. So first is we have to conduct an interview. Ma'am, do you have any ear problems? Do you have any ear medication? Do you have any difficulty in hearing? So first is we have to inspect the auricles for color, symmetry, and size, and position. Next is we have to palpate the auricle for texture, elasticity, and area of tenderness. Using the otoscope, inspect the external ear canal for cerumen, skin lesions, pus, and blood. Also, inspect the tympanic membrane for color and gloss. Lastly is we have to perform a gross hearing acuity test. So, we assess client's response to normal voice tones to see if client has difficulty hearing the normal voice. We use a watch and we have the patient to conclude one ear. So, place the watch 1 to 2 inch from the occluded ear and we ask the patient what she can hear. Next is we perform a Weber test and lastly conduct a Rene test. After all the procedure, we may document all of our findings. After the assessment of the ears, we may now proceed to the assessment of the nose. So first is we have to conduct an interview. Determine the client's history of the following: allergies, difficulty breathing through the nose, sinus infection, injuries to the nose or face, nosebleeds, any medication taking, and any changes in sense of smell. So in the assessment of the nose, the first thing we need to do is to inspect the internal nose for any deviation in shape, size, or color, and flaring or discharge from the narest. Lightly palpate the external nose to determine any areas of tenderness, masses, and displacements of the bone and cartilage. Next is to determine the patency of both cavities. Ask the client to close the mouth, exert pressure on one narest, and breathe through the opposite narest. Repeat the procedure to assess the patency of the opposite narest. Inspect the nasal cavities using a flashlight or a nasal speculum. Observe for the presence of redness, swelling, growths, and discharge. In the assessment of the facial sinuses, palpate the maxillary and frontal sinuses for tenderness. And then, document findings in the client record. After assessing the nose, we can now proceed to the assessment of the mouth. The first thing we need to do is to determine the client's history of the following: routine pattern of dental care, last visit to the dentist, length of time ulcers or other lesions have been present, difficulty breathing through the nose, any denture discomfort, and any medication the client is receiving. So in the assessment of the lips and buccal mucosa, inspect the outer lips for symmetry of contour, color, and texture. Ask the client to pout the lips and whistle. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions. Next, in the assessment of the teeth and gums, inspect the teeth and gums while examining the inner lips and buccal mucosa. Inspect the dentures. Ask the client to remove complete or partial dentures. Inspect their condition, noting in particular broken or worn areas. In the assessment of the tongue or floor of the mouth, inspect the surface of the tongue for position, color, and texture. Ask the client to protrude the tongue. Inspect the tongue movement. Ask the client to roll the tongue upward and move it from side to side. Inspect the base of the tongue, the mouth floor, and the frenulum. Ask the client to place the tongue against the roof of the mouth. Next is to palpate the tongue and floor of the mouth for any nodules, lumps, or excoriated areas. Use a piece of gauze to grasp the tip of the tongue and with the index finger of other hand, palpate the back of the tongue, its borders, and its base. Let's assume that I used a piece of gauze to grasp the tip of the tongue of the patient. Inspect the openings of the salivary ducts for any swelling or redness. Inspect the hard and soft palate for color, shape, texture, and the presence of bony prominences. Ask the client to open her mouth wide and tilt his head backward, then press with tongue blade as necessary, and use pen light for appropriate visualization. Inspect the uvula for position and mobility while examining the palate. To observe the uvula, ask the client to say ah so that the soft palate rises. In the assessment of the oropharynx and tonsils, we need to inspect the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gag reflex. To expose one side of the oropharynx, press a tongue blade against the tongue on the same side about halfway back and open the mouth wide. Use a pen light for illumination if needed. Inspect the tonsils for color, discharge, and size. Elicit the gag reflex by pressing the posterior tongue with tongue depressor. So after the procedure, we can now document the findings in the client's record. So that is the proper procedure of the assessment of eyes, ears, nose, and mouth and oropharynx of the patient. So that would be all. Thank you.